Do you have chronic inflammation in your body, or are you trying to find out? So, basically, chronic inflammation in the body does increase the risk of developing heart disease as well as, cholesterol blockages in the arteries. And so, the test for that generally done is high sensitivity CRP. And this is a blood test, and if you get it done and it's more than 3 milligrams per liter, then that's a sign that you have chronic inflammation in your body. Now, you would get this test when you're not having any infections going on because infections are expected to increase the inflammation in your body. And so you would get this test, when you're not actively having any type of infection to see if there is any signs of chronic inflammation going on. And if there is, you would discuss, with a cardiologist if you have, risk factors for heart disease, what to do next with that information. Now, there are other blood tests you can get like fibrinogen and IL-6, and there's some other ones, but high sensitivity CRP so far has been tested the most in studies, and that's the one that's generally used so far. Now, that could change in the future, but that's what's being used currently. And then there are also imaging tests to look at specifically your heart and look for inflammation in your heart. And that's usually a cardiac CT or a PET CT, but that's not usually done unless you have some specific indications for that, because it generally tends not to be useful information unless you have some specific, symptoms or reasons to get those tests. And usually it's done at academic centers. If you're looking specifically for inflammation, those tests are done at larger centers. Usually you have to have an indication. But for most people, if you're trying to find out about chronic inflammation in the body, high sensitivity CRP, the blood test, would be the best option for that.